Afternoon, everybody, and welcome to a presentation on Gewardz Health. Some of you I know, obviously, through the whole VBC, and it's a great organisation to be part of. So a little bit of background. We've been involved in working in the SME space around growth. We built a technology platform that started out in rewarding B2B customers, going, if it's good enough for Tesco's to have a club card, why isn't every business running a reward program? In 22, we got asked to start looking at the employee space. And the big challenge, and it hasn't changed, is how can we retain and recruit really good people? And I go, well, if you worked for a company like Apple, you'd give them healthcare services. And they go, well, we can't afford it. And I go, that isn't how large organizations work. So we set about to figure out, could we provide a healthcare solution that allows every business to be able to offer to their employees? And I mean that without exception. But it's more than that. As much as it's about employee well-being, and to all the HR well-being people in the room, I don't denigrate that stuff. But as a business owner, I also needed to be good work and good for the business. At the end of 2024, we got appointed as the Small Firms Association Healthcare Partner. And that is a partnership that's growing all the time. And you'll see a lot of advertising coming out of that the next couple of weeks. Within the whole well-being space and the health space in Ireland, you've got two challenges going on. One is an awful lot of it is crowded by very large organizations who have this ethos of too small to serve. So a lot of time we get clients coming to us saying, I've only got 3, 4, 5, 6, 7 employees. I've been told I'm too small to serve. I don't agree with that. Around this group here, everyone's got ambition. The people with 3 employees today could be the 100-person, the 1,000-person employee in the next 5 years. So why wouldn't we support people on that journey? And secondly, EAP, which I hate acronyms, which stands for Employee Assistance Programs, don't work. The stuff that gets offered by Spectrum Life, by Leah, those things, has a take-up rate that's less than 1%. So clearly there's a problem in that the concept around well-being for employees is very valid, very genuine, very needed. I'm an employer, so I understand it. But what's in the marketplace for SME businesses doesn't work. And here's what people are facing in terms of healthcare challenges right now. So we're seeing GP delays and bottlenecks. You can't do any of the GP appointments. You're talking 1.5 to 3 days is sort of pretty good. If you're in the UK, it's 21 days or something ridiculous. That creates increased stress, longer healing times because of the stress related. And specifically when it comes to children, you know, we'll do anything to make sure a child gets sick or gets well better. And yet that whole anxiety kicks out. And of course, for me, big bugbear, I've got 4 kids, so we're a family of 6. In my case, my GP is €80 every time I want to go and see him. And with all due respect, he's a great fella. But paying him for 80 quid for a prescription is not something I really want to do. And then there is employee guilt, although I'm hard pressed to believe that, but apparently there's employee guilt out there. The business challenge, it's all about lost productivity. For every day that one of my employees isn't available in the office, it's calculated about 130 of it lost to me as a business. So we can see a financial impact of illness. Morale, if somebody's out for a while and other people are picking up the slack, then that becomes a morale challenge. But here's the thing that I hadn't realized until we started research, is that for parents, particularly mothers, in 64% of the cases, they're the people who have to jump and figure out how to get the children better. And so you get this skew. We talk about the diversity, equality, and inclusion side of it, and yet this happens when children become sick. And the other thing that we get challenged on is this 5-day entitlement that people have that get brought in about sick leave. And the answer is you're wasting 4.2 days just trying to attend or just waiting for GP appointments. The 5 days is a misnomer in terms of the reality in the marketplace. And we don't see it, by the way, we haven't seen a boost in people taking more time off just because they have access to our platform. I think this is going to become a bigger challenge. We can see what's happening with the geopolitical circumstance in the US, the impact of tariffs, the warnings coming down, is that we're going to see this challenge on people and incomes. There's this area of the Irish dynamic or demographic that doesn't get talked about in the papers enough about the squeeze middle. So 70% of workers don't have an employer-sponsored healthcare, of which 55% of those are SME employees. So it's a very significant amount of people. And that squeeze middle is determined as those who earn too much for a GP card or free medical card, but just simply don't earn enough to be able to pay for health insurance. And in my own case, I was a member of Irish Life Healthcare until last November, when they sent me my premiums increase that was increased by 26%. So I had to go find a new player in the marketplace. So we are getting squeezed out of it. So this financial pressure, the wait times, the employee disruptions piece is a key element that's challenging everybody. Our solution, add GP appointments into your normal employee wellbeing program, and you change what happens. It gives total workforce coverage. So I'll show you some demographics around that. And where you see employee wellbeing programs have a utilization rate of about 1%, which means 99% of people don't use them. In our case, we see utilization. In fact, that number is low. It's somewhere now closer about 12%. Any given time, 12% of our members are using our GP booking service. And I talked about affordability. We're less than 1 hour's wages per employee per month. And that covers the employees and their family for access to HSE and GPs for unlimited 7 days a week, 8 a.m. to 10 p.m. So as I said before, our aim, every business can now afford to provide a healthcare solution. It's all very easy talking that stuff, but I think the best thing to do, if I can use the technology here. So this is our website, gewardzhealth.com. And when somebody registers on our site, we're straight through on a booking page. I've used this 14 times in the last 15, 16 months. When you register, which is very straightforward, you're straight on our booking engine. There's no form filling. There's no wait times. As soon as you register, you can begin to book a GP appointment straight away. So you can see Kate, my daughter Kate is under 16, so I have to be present for her GP appointment. Grace and Jack are over 16, so they can have their own appointment with GPs. I can have a male or female GP. I have no preference. This is live, by the way, and I can have a phone or a video consultation. So interestingly, about 2/3 of people will have phone over video consultations when they use their service. I personally, I like to see a GP and see who I'm talking to. And I see a GP at 18:24 today. So that's live data. So within the next 5 hours, I'll have a GP appointment. Allows me to get home, sit comfortably at home and get it done. That GP will either give me a sick note if I need it. They will give me a prescription to a pharmacy of my choice. Or they will give me a consulting letter to go and see a consultant if they believe that's what's needed. So does it work? Apologies. So you can see in the last quarter, this is the demographic of people who've used our platform. 2/3 male, 1/3 female. Well, we all know the female gender are stronger people anyway, so I'm not surprised with that myself. But more importantly, you see the demographic from under 18 right through to somebody in their 60s. So at some point, every one of our members is likely to use our platform simply because they need GPs. But interestingly, it's the one benefit that we know that because it's including families has the biggest impact that we can provide at the price point that sits there right now. I mentioned we're available 7 days a week, 8 a.m. to 10 p.m. So you can see the skews Tuesday, Thursdays has had more appointments January into April. But again, the big thing about Friday, Saturday, Sundays is we don't get sick on a Saturday hoping to God we can talk to a GP at 8 o'clock on a Monday morning trying to get an appointment and get ahead of everybody else. So we stopped that stupid scramble. In my own case, I had a daughter who had an infected thumb on a Saturday morning at about 8:30 in the morning. She was able to speak to a GP on a platform by 9:30 and antibiotic by 10 o'clock on Saturday morning. Now, that's what this is all about. The power of taking that stress away from us as parents is just as important as me as an individual using it. And I mentioned before, subscriptions make up the vast majority of what people get diagnosed, but we do provide consulting letters and we will tell you to go back to a GP if you think it's important. And then one of our clients pointed out what I hadn't been aware of is this sick note loop. somebody is off work for 3 days sick and they come back into work. They then get told they have to get a sick note. They then have to take a half day off work to go get a GP just to get a sick note to come back into work. It's kind of a stupid cycle that we're also able to break as well as a consequence of that. And these are some of the things just to bear in mind. We talk about duty of care. I travel quite a bit into the UK, into Europe. And so knowing that I've got a GP at the end of a phone, an Irish registered HSE GP can provide prescriptions anywhere in Europe. So that's important to be able to know. And then one of my employees, Emma, I got a text message on my phone at 2:30 one morning on the WhatsApp going, "In, can I register because I need to get my child to see a GP while they're away on holidays?" The interesting thing is we serve the UK and Ireland, but UK GPs can't prescribe outside the UK because of Brexit. So it's created this anomaly in terms of the geographic divide that we're able to get past for people, which is also important. And that's, for me then, it's about reward, no BIK, because it's a medical service provided to all staff. There's no BIK, which is great. We've enough taxes to pay without being taxed more. The ability to retain, you can now offer something more. It goes beyond just the pay slip and the smile to be able to go and say, "Iain, thank you very much for your service. We'd like to give you GP service for you and your family and access to other wellbeing services." And that becomes a really nice way to be able just to make people pause before they go send that CV out. And when it comes to recruiting people, it's still an employee marketplace, despite what we're hearing and saying. And so the ability to go beyond just a salary fight means that you stand more chance of recruiting that right person. So I think that's hugely important as well. And ROI, I mean, I am a business owner. I know that, my staff have used this several times. One of our wellbeing services, non-HR legal advisory, and one of my employees has gone through an awful lot of hassle to do with family law. And as it happened, when she went into court through having access to the wellbeing service through our app, she was better prepared than her solicitor was for the family law case she had to place. In fact, the solicitor asked her for her notes afterwards, and she said, "Not a chance." So it's the fact that it's a whole rounded service for all employees, I think, is hugely important. So that's it. Want to know more? Book a discovery call. You've seen the demonstration. That's the core of it. We are a plug and play. We do everything for our clients. So we'll onboard the employees. We'll do the communication. We'll do the follow-up. We run a monthly check-in newsletter that we send out to everybody to remind them that they have it. And that way it also protects our clients, because we've had a couple of instances where employees have gone to our clients and said, "I never got any information about this." And we're able to go back and go, "Well, actually, Iain Cahill opened that email on 3 occasions." So we're able to back up what's happening for our clients as a defensive mechanism in some respects, which is also important. So that's it. That's Gewardz Health.